Welcome, everyone. Today's webinar is how to prevent a heart attack, and I'm Dr. Tracy Paschke. And let's get started. So a little about me. I'm a board certified cardiologist. I'm also board certified in internal medicine, and I have 25 years of experience as a cardiologist. I'm a member of the American College of Cardiology, which is our sort of governing board, and then a member of these different groups. I'm also a certified life coach, and I focus on health and wellness. And after spending 25 years taking care of people after they had their heart attacks and heart failure, I decided to help people prevent those events in the first place. So I founded my company, Heart Health Prevention and Wellness, to do that. And I specialize in integrative cardiology. So I take parts of traditional Western medicine and functional medicine and some Eastern medicine practices and integrate all those into a program that I think is beneficial for people focusing on prevention and risk factor mitigation. This is my company, Heart Health Prevention and Wellness. Today, I'm going to help you understand a little about heart health in general, and then we're going to talk about the different pillars of heart health and about heart attacks and what causes them. And then we'll talk about some preventive measures and screening and some integrative approaches. So why is this important? Cardiovascular disease is the #1 killer of men and women, and a lot of women don't know that, but cardiovascular disease kills more women than cancer, diabetes, Alzheimer's, accidents, and chronic respiratory disease combined. Cardiovascular disease accounts for almost 1 million deaths per year, and in the United States, someone has a heart attack every 40 seconds. So it's a huge problem. So after those sobering statistics, we need some good news. The good news is that the American Heart Association estimates that 80 to 90% of cardiovascular deaths are preventable with lifestyle modification and treatment of risk factors. So again, that's what I focus on in my practice. So here's a little taking you back to high school biology. This is a picture of the heart, a video of the heart beating. So remember, the heart has 4 chambers: the right atrium, right ventricle, left atrium's up under there. And there are 4 valves in the heart that open and close and keep the blood moving one way through the heart. And the heart pumps blood to all the arteries in the body, supplying blood, which carries oxygen to keep our body functioning normally. There are a lot of different types of heart disease. There's coronary artery disease, which is what we'll be focusing on today with our talk about heart attacks, because that falls under this category. There's congestive heart failure, you may have heard of. I don't like that term, but it means that the heart pumping function is impaired in some way. There are abnormal heart rhythms. Atrial fibrillation is a common one, SVT that you might have heard of. There's structural heart disease, so this is problems with heart muscle or heart valves. Hypertensive heart disease, so high blood pressure, long-standing high blood pressure for many years can cause changes in the heart muscle, and it's a risk factor for coronary artery disease. And then there are aortic diseases, problems with the aorta like aneurysms. There's peripheral arterial disease, falls under this category of cardiovascular disease. So that's blockage in the arteries that supply blood to the legs, or if it's in the neck, to the brain. And then there's congenital heart disease, which are things that people are born with, kids are born with. So we're going to focus today on coronary artery disease because that has to do with heart attacks. So the classic scenario is someone is having their normal day and they feel pressure or tightness in the center of their chest, like an elephant sitting on their chest is the classic description. Maybe they're feeling short of breath with it and they break out in a cold sweat. They might have some nausea. So those are classic symptoms of someone who's having a heart attack. They call 911 and they get to the ER, and the ER doctor will do an EKG. Sometimes that's even done in the ambulance, and it shows these changes on the EKG that tell us that someone's having a heart attack. So we rush them up to the cath lab, and we either go through the artery in their leg or the artery in their wrist, and we go up into the heart arteries and shoot x-ray dye and take pictures. So this is an example of one of the pictures that we might get. So this is the catheter that goes up into the heart artery, and then we shoot this dye in the artery, and you can see right here, you've got this irregular looking area where it's blocked off. So this should look just like this. These are like branches of a tree. They start off big and they get smaller as you go down, but you can see this area right here, there's a tight blockage there. And so that's an area of plaque rupture that's impairing blood flow and causing problems. So if we look at the inside of that artery, what's going on is that you have a cholesterol plaque, and this plaque has become unstable and the plaque ruptures. So most heart attacks occur in the setting of a mild plaque. So you have this mild plaque that's sitting there, not causing any symptoms or problems, and then the plaque becomes inflamed, and the thin fibrous cap, the top of the plaque, like a covering of a volcano, it becomes dislodged and it breaks open, and all the stuff that's in this plaque is released into the blood vessel, and that makes the blood clot, and it affects the artery. So this is what it looks like in a microscope. You have this plaque that sits inside the blood vessel, and then it becomes inflamed, and then the plaque ruptures. So it's this mess in there now, and that can impair blood flow. And if it cuts off blood flow completely to that artery, then that part of your heart muscle can die, and that's what a heart attack is. So the blood has been cut off completely here, and this area of your heart's not getting any blood flow, so the area downstream from that ruptured plaque is not getting normal blood flow. And if the artery is not open promptly, either with a stent or sometimes clot busting drugs, then that part of the heart can die. So that's why we rush around and get people to cath lab. We're trying to get that artery open quickly so this part of the heart doesn't die. Because if that part of the heart dies, it can affect overall heart function. That part of the heart that was where that artery supplied blood flow, that part of the muscle doesn't work anymore, and that can lead to congestive heart failure down the road. Sometimes it can cause abnormal heart rhythms, and that can be a sort of a consequence of a heart attack. And then sometimes it can affect the heart valve. So if you have a heart attack in certain areas of your heart and this part of the muscle is damaged, it can affect where these heart valves, how they open and close, and that can cause problems with leaky heart valves. So we want to prevent a heart attack, right? So what are at all those downstream effects? It's a lot easier to prevent disease than it is to treat the disease. So what are the risk factors for having a heart attack? We group them into what we call non-modifiable risk factors and modifiable risk factors. So what are the non-modifiable risk factors? Things that we can't change. So that's things like age, right? Risk of heart disease goes up as we get older. For women, it goes up after we hit menopause. Sex, again, women have a lower incidence of heart disease before menopause. We catch up with men after we go through menopause, but when we're younger and we have estrogen, that's protective. Ethnicity, we know that some ethnic groups have a higher risk of cardiovascular disease. South Asian populations have a higher risk. And then genetics, right? So we know that some risk of heart disease is transmitted through genetics. But again, remember one of those first slides I showed you that it's thought that only 20% or so of heart disease is genetic. The rest is lifestyle related. So that's where these modifiable risk factors come in. So things like an unhealthy diet, physical inactivity, smoking, high blood pressure, high cholesterol, diabetes, and obesity. These are all risk factors for heart disease, but these are modifiable. So we can work on these things, try to improve them. So things like diabetes and high cholesterol and high blood pressure that are risk factors for heart disease, we don't want to even get those things in the first place. So it's not just controlling these risk factors, but how do we, so even step before that, how do we not get these risk factors in the first place? So that's what my clinic does. That's what I focus on, preventing, helping people not even get things like diabetes and high blood pressure and high cholesterol. So this is the roadmap that I follow in my clinic. We do an extensive intake and review. This is like an hour and a half visit. We talk about everything, your family history, you keep a 3-day food journal. We review that, any medications and supplements that you're taking that can affect things, your stress level, what you do for fun, how is your sleep. So this is an extensive intake and review of any old things that you may have had, any prior testing or labs, and we go over all that. And then we do some advanced lab testing. So we check some things that you may not have heard of, and we'll talk about that a little more in a minute. And then we do some advanced diagnostics. Again, we'll talk about that more in a minute. And then we go through all these pillars because all this is important in preventing cardiovascular disease in general and heart attacks specifically. So the first part I tell people is to know your numbers, right? So this falls under this lab testing, and some of it's even simpler than that. For instance, blood pressure. These days, you can get a good blood pressure cuff at any retail place where you shop. These are under $100 now, and they're pretty good. I tell people to buy an upper arm cuff, not a wrist cuff. The wrist cuffs aren't as accurate. So buy an upper arm blood pressure cuff, keep it at home, and check your blood pressure several times a week. So not once a year when you go see the doctor, but you want lots of data points. So what is your blood pressure in the morning, and what is it in the afternoon? Maybe even check it at work when you're stressed at work. So that tells you what your blood pressure is doing all the time. Blood pressure is the stress on your blood vessels with your heartbeat. So there's a top number called the systolic reading and the bottom number called the diastolic reading. So systolic, the higher number, that's the pressure with the heartbeat. And then the diastolic number, that's during relaxation. The most recent guidelines say that normal blood pressure is less than 120/80. We know that people do better long-term when your blood pressure is less than 120/80. Elevated blood pressure is between 120 and 129 for the top number and less than 80 on the bottom number. Stage 1 hypertension is systolic readings 130 to 139 or diastolic readings 80 to 89. And then hypertension stage 2 is systolic readings greater than 140 or greater, and diastolic readings 90 or greater. So you need to know your numbers and know where you fall. And your goal is this normal blood pressure of less than 120/80. So that's, if you don't have high blood pressure and you're not on medications, that's your goal. And if you do have high blood pressure and you're on medications, that's your goal. So another number everyone should know is their LDL cholesterol. So this is a calculated value on a standard lipid panel, but most people are familiar with this, and your primary care doctor may check this even once a year. So optimal LDL cholesterol is less than 100 milligrams per deciliter. That's for the general population. People with known cardiovascular disease, so people that we know who have plaque, or who've had a heart attack in the past, their numbers need to be even lower. So LDLs less than 70. Most cardiologists aim for LDLs of 50 or less. And then there are the different readings as you go up. Hemoglobin A1C is another commonly checked number that people should be aware of and know your number, because this is a measure of your blood glucose for the past 2 to 3 months. It's screening you for diabetes. We know people with diabetes, that's one of the strongest risk factors there is for cardiovascular disease, for heart attacks. So you need to know your numbers, and your numbers should be normal, right? Normal is less than 5.7. And then there are some newer numbers that we need to check. This is Lp(a). So this is a type of lipoprotein that we know that's more atherogenic and more thrombogenic, so more likely to cause plaque and blood clots. This one is mostly transmitted genetically. So often this is elevated in people who have a strong family history of heart disease. So maybe your dad, your uncle, your brother have all had heart attacks. Often when you get your Lp(a) checked, it's high, and that's a genetic thing. The European Society of Cardiology and the National Lipid Association recently recommended that everyone have their Lp(a) checked at least once in your lifetime, because again, if it's elevated, it significantly increases your cardiovascular risk. So then there are a bunch of other things that we can check. So again, in my clinic, this falls under the advanced lab testing. Things like NMR, which looks at your LDL particle size. We know that people who have small, dense LDL particles are at increased cardiovascular risk. We check PLA2, a plaque test, you may have heard it called. That looks at inflammation in plaque. Myeloperoxidase is an inflammatory marker, homocysteine, IL-6, oxidized LDL, and ApoB, that's another important one. That's one that probably everyone should know. Again, these are all going beyond the standard lipid panel, right? So looking a little more deeply at your personalized risk, because we know if these things are abnormal, that means you have a lot of inflammation in your body. You have a lot of things going on in plaque that aren't good. And so those things increase your risk. Because remember, it's two parts, right? It's not only the plaque, but it's the inflammation. So they're both things that work against you. And we want to make sure we identify not only markers of atherosclerosis, such as high cholesterol and high Lp(a), but also markers of inflammation, such as myeloperoxidase and hsCRP. That's another common one, because that tells us that you have increased inflammation in your body. So then we want to do advanced imaging, right? Because we want to know, do you have plaque? And do you have plaque, and where is it, and how bad is it? And do you have hard plaque, which is more stable kind of plaque, or do you have soft plaque, which is the more unstable type of plaque that's more likely to rupture and cause strokes and heart attacks? So there are lots of ways we can look at your arteries. The one I use mostly is coronary CTA. So it's a 3-dimensional picture of your heart arteries. So it takes these pictures, and then we can cut through and look inside your arteries with this and look for plaque. And then we can add what's called a Clearly analysis. So that Clearly analysis is sort of a software analysis that lets us determine whether your plaque is hard plaque, soft plaque, or mixed plaque. And again, it's important because soft plaque is the plaque that's more likely to rupture. So once we get all those, your testing, and we look at your risk through your lab markers and your advanced cardiac imaging, let's say you have a 20 to 30% soft plaque in your artery. It's not causing you symptoms or problems, but some of your inflammatory markers are elevated. your LDL cholesterol is high, maybe your ApoB is high. So you're at risk. Just even if you don't have high blood pressure, high cholesterol, or diabetes, just based on those inflammatory markers and your cardiac imaging, we know that you're at risk for having a heart attack down the road. So what are the things that you can do in your lifestyle to modify those risk factors? And a lot of these lifestyle things that you can modify are at least, or if not more effective than prescription medication. So these should be the foundation for everybody. So the first is diet. So we know that a whole food plant-based diet is the best diet for your heart. There have been lots of studies and there are lots of resources that I direct people to about this. We know that the standard American diet, the so-called SAD diet, is high in increases inflammation. It's high in animal protein and saturated fat. It's high in processed food. And all those things increase inflammation in the body, which again is part of cardiovascular disease. So we want to eat a diet, less animals and animal products, high in fruits and vegetables, high in whole grains. So like quinoa, brown rice, barley, farro, those are all good, healthy grains. We want a diet high in legumes, so beans, peas, lentils, high in fiber, right? Because all these things, the beans, the fruits, the vegetables, that's all high in fiber. Most Americans don't get enough fiber in your diet. Fiber helps keeps your bowels moving, takes out calories. High fiber diets takes out the calories, takes out the toxins in the body. So you want a high fiber diet, and nuts and seeds are good to add. Things like flaxseed, ground flaxseed, which is an antioxidant, anti-inflammatory. So all those things, green tea is good, it's anti-inflammatory, black tea too, but green tea is even better. Alcohol increases inflammation in the body. It can increase triglycerides. It's not good for your brain. So I tell people to try to stay away from alcohol. So sometimes it's hard. Diet's a tough one, right? Because we've been eating the same thing for 50 years or whatever. We learn our dietary habits from our parents. Often it's culturally mediated. So you just have to try some new things, right? So I tell people to start with like a meatless Monday, right? So on Mondays, instead of making your usual meal, say of meat tacos, try substituting maybe brown rice and black beans instead of meat. So you just try your recipes with some substitutions. These days you can get dairy-free cheese, you can get plant-based meats, plant-based milk. So there are lots of options. So it's fairly easy actually to make substitutions. Instead of scrambled eggs, you can have scrambled tofu. It tastes the same if you use some spices with it. So you just have to start somewhere. And a lot of people find that they feel better when they eat less meat and less processed food. So you'll probably lose weight if you change to a whole food plant-based diet, not even really trying, right? But just because you're cleaning up your diet. Forks Over Knives is a great resource for people trying to transition to a plant-based diet. So I tell people to check them out. They have a website and a magazine that they publish several times a year, so that's good. I think they also have a Netflix documentary, so that's a good resource. So the next thing we want to focus on is exercise, right? We know that exercise is great for the heart. American Heart Association recommends 150 minutes of moderate intensity aerobic exercise a week. So 30 minutes, nice brisk walk every day will get you there. We also need some resistance exercise for our bones and muscles. So exercise is important. It's important to keep our weight in check. It helps us process our blood sugar. It helps us keep our bones and muscles strong so we can age better. It's great for our brain health. Exercise releases substances that sort of clear out the toxins in the brain. So it has multiple health benefits. The next thing we focus on is restorative sleep. So we know that people who have poor sleep or sleep apnea, it drops your oxygen during sleep, and that can have effects on the heart, increase your risk of cardiovascular events. So we check people's sleep, make sure they're getting their 7 to 9 hours. Most Americans don't get the recommended 7 to 9 hours, so we start there. We look at your sleep habits and hygiene, try to make some changes there. We do screening for sleep apnea, because even if you're sleeping the 7 to 9 hours, if it's not good restorative sleep, you're still not getting all the health benefits. So the deep stages of sleep, that's when the brain, again, clears out toxins through the day. That helps consolidate our memory. So we want to make sure we're getting good sleep, so it's good for the heart. Stress management is an important aspect of cardiovascular health. We know that people who are more stressed have increased inflammation in the body. Acute stress, like swerving out of the way when there's a car coming at you, serves a purpose, right? It keeps us safe. But in our world today, we're bombarded with stressful things, your family, your job, your finances, seeing people on the other side of the world having problems. It's just this constant barrage of things that stresses us out, right? It increases our adrenaline and our cortisol hormones, and it puts us in this state of chronic stress. And it's not good for the body. So over time, it can increase blood pressure. It can increase inflammatory markers in the body. It can cause abnormal heart rhythms. So we want to focus on ways to manage our stress. So things like yoga and journaling, reading for pleasure, taking time for ourselves, sauna, sit in the hot tub, warm baths. So whatever you can, creative things that helps with stress management, drawing or writing or painting, play. So things that we used to do as kids that we don't do as much when we're adults, all that creative stuff is good for stress management. So think of some ways that you might be able to tackle this, because it's very important. And then, of course, avoiding risky substances. We know that people who smoke have increased risk of cardiovascular disease. So obviously we recommend everyone stop smoking. Vaping is not much better, so we don't recommend that people vape either. Vaping and cigarettes are full of substances that change how the blood vessels react, make them more likely to develop plaque and blood clots. So we want to stay away from those substances. Alcohol, we've talked about a little bit. I recommend that people cut out alcohol. Alcohol, if you drink a lot of alcohol, it's a direct toxin to the heart muscle and can weaken the heart muscle. And then marijuana, that's the latest thing, since marijuana is legal in a lot of places. Some people are using marijuana. We don't have a lot of data on marijuana yet, but the things that have come out are not looking good for marijuana and the heart. So I'm telling people to avoid marijuana until we get more data. And then social connection is important, right? So we know that people who have a good social connection have decreased risk of depression, they live longer. People in the world in the blue zones who live the longest have very strong social connections. So this is important. So it's important to find people to connect with through either your church or temple or mosque, connect with people maybe who have similar hobbies, the Chamber of Commerce, you can volunteer. That's a great way to meet people and connect. So just try to find a group of people. It could be your family, friends, or people in different groups that you connect with. We know all that is good for your health, lowers inflammation, lowers inflammatory markers. So that's a good way to stay healthy. So the point of all this is to keep our hearts healthy, to age in good health, right? So we want to not only increase our lifespan, but we want to increase our health span. So we want to live a long life in good health. And we know that people who have chronic diseases do worse as they age. So the goal is to prevent those long-term chronic diseases that affect our health as we get older. So we don't want to get diabetes, and we don't want to get high blood pressure, and we don't want to develop peripheral arteria disease or have a heart attack, because then that puts us at greater risk to develop congestive heart failure, which puts us at risk to develop abnormal heart rhythm. So see, once you start down the road, other things can come up that are related. So the best way to avoid that, avoid chronic illness, is to stay healthy. And often when we're younger, we don't think much about our health, but as we get older, it's important to think about all these things that I've talked about and work on your mindset. Well, I'm 50. I want to live to be 100. What's the best way? I want to live to be 100 in good health, right? I don't want to be in a nursing home and not able to get out of bed, but I want to be able to play with my grandchildren and my great-grandchildren, and I want to live independently. And what's the best way to do that? The best way to do that is to stay healthy. So that should empower you to want to do what you can to stay healthy, to stay, and it's never too late to work on these things, but obviously the earlier the better, right? Before you develop some of these chronic illnesses. So that's the goal. So I offer a free health consultation through my clinic, so you can scan this code and it'll direct you to a calendar to schedule a free consultation, and we can talk about some of this a little more in depth, and you can tell me about what's going on with you, and we could come up with a plan. So again, it's more personalized. Prevention is about you and what's going on with you and what are your risk factors and your family history and your markers showing and your advanced testing showing. So it helps us develop a personalized plan for you. All right, thank you for joining me. If you have any questions, you can email me at info@hearthealth.care. And I'll check the chat before I sign off here, just to make sure nobody has any questions. No, no questions. All right, you can email me your questions if you have any. Otherwise, I'll see you next time. Take care.